Hey guys, welcome back to my channel. Firstly, I want to give you guys a short preview of this video. So, Turner syndrome is basically a female sexual disease in which X chromosome fails to separate during an embryo formation. So, let's get into the video. Turner syndrome is a genetic condition that only affects female. The condition is caused by an abnormal chromosome and affects about 1 in every 2500 baby girls, but is much more common among the pregnancies that do not survive to term, miscarriages, and stillbirths. TS was named after Dr. Henry, who had discovered the condition in 1938. How do people get Turner syndrome? Turner syndrome is typically caused by non-disjunction. A pair of sex chromosomes fails to separate during the formation of an egg or sperm. So when an abnormal egg unites with a normal sperm to form an embryo, that embryo may end up missing one of the sex chromosome X rather than XX. Advanced maternal age is not associated with an increase in incidence. As you can see, these paired chromosomes, one has 33 paired chromosomes, but the defective gametes has 22 paired chromosomes. So the embryo is defective and could not contain X chromosome. This condition is called mosaicism. The abnormality is not inherited from an affected parent, not passed down from parent to child, because women with the Turner syndrome are usually sterile and cannot have children. Types of Turner syndrome. Cases of TS where an X chromosome is completely missing are sometimes referred to as classical Turner syndrome. About 30% of girls with the disorder are only missing the X chromosome in some of their cells. This mixed chromosome pattern is known as mosaicism. Girls with this pattern may have fewer symptoms because they still have some normal XX cells. Y chromosome pattern. In a small percentage of cases, Turner syndrome, some cells have one copy of X chromosome and the other cells have one copy of the X chromosome and some Y chromosome material. These individuals develop biologically as girls, but the presence of Y chromosome material increases the risk of developing a type of cancer called gonadoblastoma. Characteristics. Girls and women who have TS often have a wide range of different medical symptoms or characteristics. However, there are two characteristics that occur in almost all cases of TS. They are being shorter than average height, a lack of development of the ovaries leading to infertility. One of the missing genes on the X chromosome is the SHOX gene, which is responsible for long bone growth. The missing SHOX gene is the reason girls who have the short disorder are unusually short. Other missing genes regulate ovarian development, which influences sexual characteristics. Possible symptoms in young infants include swollen hands and feet, wide and webbed neck, and low and distinct hairline. A combination of the following symptoms may be seen in older females: absent or incomplete development at puberty, a broad chest and widely spaced nipples, drooping eyelids, dry eyes, and infertility. No periods, absent menstruation, short height, vaginal dryness, arms that turn out slightly at the elbow. As you can see, swollen hands and feet of a premature baby or indistinct hairline of a lady. Clinical features: short stature 143 to 145 cm tall, loss of ovarian function, hormone imbalances, thyroid and diabetes, stress and emotional deprivation, diseases affecting the kidneys, hearts and lungs or intestine, bone diseases, learning problems, example in maths. A heart murmur sometimes associated with a narrowing of the aorta, a tendency to develop high blood pressure, so this should be checked regularly. Scoliosis occurs in 10% of the adults. The thyroid gland becomes underactive in about 10% of the women who have Turner syndrome. Older or overweight women with the Turner syndrome are slightly more at risk of developing diabetes. Osteoporosis can develop because of a lack of estrogen. Diagnosis: about half of the cases are diagnosed within the first few months of a girl's life by the characteristic physical symptoms, swelling of hands and feet or heart defect. Other patients are diagnosed in adolescence because they fail to grow normally or go through puberty. When the doctor suspects Turner syndrome, a blood sample can be used to make a karyotype and the diagnosis can be confirmed. Turner syndrome may be diagnosed during pregnancy with a chorionic villus sampling, CVS, or amniocentesis. Alternatively, an ultrasound can identify the disorder by its physical symptoms before the baby is born, signs of underdevelopment. Amniocentesis is basically a prenatal test that takes amniotic fluid from around the fetus in the uterus. The fluid is tested to see if the fetus has certain medical health conditions. Treatment. Hormone replacement therapy is the best way to treat this disorder. Teenagers are treated with a growth hormone to help them reach a normal height. They may also be given low doses of androgen male hormones, with females also produced in small quantities to increase height and encourage normal hair and muscle growth. Some patients may take the female hormone estrogen to promote normal sexual development.
'Cause we can see it. Here's to the one.